Good evening, everyone. Welcome back to my channel. This video for young dentists or dental student who trying to learn something from online dentists like me, trying to teach you guys basic concept of diagnosing and treatment for emergency case. This is the bite wind of the right side. Chief complaint of the patient is his tooth number 3 bother him. Look at the x-ray, see just some calculus around the number 3, 2, and 4, 5 area. Do some calculus, and there is I couldn't get the bite wind. The assistant cannot take the bite wind on the back side. But if you look at the PA, you can see the distal radiolucency of tube number 1. This is the indication that you will be looking at the clinical inside the patient mouth to confirm if there is true caries. In fact, there is a caries on the clinical evaluation of distal buccal on the occlusal part of tooth number 1. So this is the main reason why the patient come in to complain about the pain. Now check out how we take out this tooth. As you can see, this tooth have 3 roots, so with curved root. Typically, if you're not careful, you might break the tooth porosity. So the way I handle this one is I would use elevation, try to luxate the tooth until it fully loose, and erupt it occlusal slowly, and you can basically, after you luxate enough with the elevator, then you would use the 150 forceps and try to graft the occlusal and just twist back and forth and buccolingually, and it should come out right out. And so that's how it works. And you can see that clinical examination, you can see a big hole of decay there. This is the reason why the patient have so much pain on the right side. So it's also possible that there is a combination of acute gingivitis or periodontitis, but I don't believe that that's the main cause. This is the main cause. Thank you for watching, you guys. Just hope you enjoy and see how you have to look at the wisdom tooth, especially the young patient. You have to look at the way in the back, and typically sometimes you just trying to focus on the bite wind, and you lose you miss the possibility of the distal decay of tooth number 1 or number 32 or number 16 or 17. These are important spots to be looking at. Typically, if you miss it, patient come back a few days or a few weeks later, they have so much pain, they might complain about your lack of confidence, unable to figure out what's wrong with them. Okay, guys, I hope you understand this. And also the thing is, when I was trying to luxate the tooth were very firm. Part of it is because of the 3 root tooth, so that require a lot of luxate, a lot of elevation from the meso lavish at the between meso of number 1 and number 2. And if you're not careful, and like I said, some people use so much force, they might break the distal tuberosity part of the tooth, which give patient more trouble with post-op. You don't want that to happen, so you have to be able to luxate and also use the 150 forceps and just take it out as nice as possible. So as you can see, there's no break in tuberosity. The tooth come out very nicely. Again, thank you for watching. Have a good one. Thank you. Take care. Bye-bye.